Welcome back, everyone. Keeping an eye on your health this afternoon. Chronic back pain can be one of the most uncomfortable and limiting conditions. If you suffer from it, you know what I'm talking about. Surgery is sometimes a last resort, but now there's an alternative, much less invasive treatment available to help relieve chronic back pain. So joining us today is Dr. Matthew Schocket from the Capital Pain Institute to explain a procedure that is called spinal stimulation. You may have heard of it. It's been around for a long time, but there is a new twist. Good afternoon.
Welcome. Thank you for having me.
Thank you for being here. Okay, tell us a little bit about this one.
So this procedure is really designed to try to control chronic pain from a different perspective than surgery, which is designed to try to fix the problem.
Okay.
And sometimes we just can't fix the problem, but we have to treat the pain somehow.
Right.
And we feel pain in our brain. We don't feel pain in our back, even though that's where you feel it. Just like a light switch. I mean, you flip the switch, but you actually see the light, correct?
Right.
And so this is a way to change that. We present a different sensation to the brain so that rather than feeling the pain, you feel this alternative sensation.
I see, fascinating. So a little bit about how the spinal stimulation works. Is it a device that you put in the back? Where do you put it, and how exactly would it work for somebody who's suffering from back pain?
So there's two steps to this.
Okay.
There is a wire with electrodes on it.
Okay.
And that is actually going to go inside the epidural space. And any pregnant woman knows what the epidural space is because that's where we put catheters for pregnant women.
Yes.
It's kind of like having a really high-tech IV in your back.
Okay.
Okay.
Got it.
Now, we put that in first, and we actually put an external battery on that, and you test it for a week. So for the first week, it's no different than having an IV in your back.
Wow.
Okay? No surgery, no incisions, okay? Just a needle, just like an IV if you put one in your arm.
And that's significant because with the back surgery, there's no going back.
Correct.
With this one, you could see if it works, and if it does, then you can take that step further. If it doesn't, then you could try something else.
Right. You're left no worse for wear.
Okay.
It comes out after a week, and then you decide. You either love it or you don't love it.
Right.
And our success rate runs about 75, maybe 80% of people who do the trial phase will go on to the implant phase. Now, the implant is obviously a little bit more invasive.
Sure.
It is going to require an actual surgery, but we only cut the skin.
Okay.
We don't actually operate on your spine. And the nice part of that is that if down the road we need to take it out for whatever reason, we can do that. Now, most of the time we don't. Long-term success rates run about 80, 85%,
Wow.
and patients are very happy. But if we need to take it out, we can.
And we're talking about minor back pain, or are we talking anything from minor to severe, serious?
So it can be anything that qualifies as chronic back pain. So, we don't want to do this for people that have had back pain for 6 weeks. Obviously, that's too large of a step.
Sure.
But people have had back pain 6 months, a year and a half, if it interferes with your life, then it's significant to you. And it doesn't really matter if you say it's a, 2 out of 10 or 5 out of 10 or 10 out of 10. If your life is changed because of the back pain, we can make a difference for you.
Okay, and Dr. Schocket, like you said, this has been around for quite some time, but there was a problem for some people who had this device, and maybe if a doctor said, well, we need to give you an MRI because we think something else is going on, they couldn't get one with the old device. What is different about this one?
So, with this device, it's the first device that is now MRI compatible, or what they call MRI conditionally safe. And it sets a list of limitations that you have to meet, but most of the MRI scanners in America can meet those limitations. And so what happens is that we have a whole group of patients. MS is probably the biggest group of patients. They have a ton of chronic pain, but they need to have MRIs every 3 to 6 months. And so we couldn't offer them this therapy. We can now offer them this therapy because they can go ahead and have those MRIs. Cancer patients is another one. Cancer patients suffer from immense amounts of pain, but the problem is if you have a tumor, there's concerns that you need an MRI down the road, and I couldn't offer this to you. Now we can offer that to you. And even just some of our regular patients in the past, if you have back pain and you've needed surgery, well, you've probably had a couple of MRIs, and maybe you're going to need one down the road. And there are patients, that we both know that have actually had to have stimulators removed in order to go ahead and have an MRI, and that's not an issue any longer. So it's been a major step forward. The other one is it used to be a contraindication indication with people who had pacemakers. So a lot of people we know have pacemakers, and we used to not be able to use these devices in pacemaker patients, but that has also been eliminated by the FDA. So we're now able to offer this therapy to a much larger range of patients.
You know, it seems like everybody knows somebody out there who has some kind of back pain. So if you want more information about this, go to capitalpain.com.
That's correct, capitalpain.com.
All right, Dr. Schocket, thank you for being here. I appreciate your time.
Thank you so much for having me.